Tuberculosis is an airborne disease that is most commonly transmitted in poor, overcrowded areas. Each year, there are more than 9 million new cases worldwide, the vast majority in densely populated developing countries such as India, China, Nigeria, and Bangladesh. There is no vaccine for the most common strain of TB, but the disease is treatable and curable. In people with HIV, however, it has become the leading cause of death. At the International AIDS Conference, the Stop TB Partnership and UNAIDS have announced an agreement to work together to address the two diseases with a unified strategy. Dr. Marcos Espinal is the executive secretary of the Stop TB Partnership.
The co-infection TB HIV, it's something that goes hands by hands. So it is not something that is going to go away unless we implement the necessary measures to address these two epidemics together. In other words, integrating TB HIV services, because what we need to make sure is the people in Africa, in Latin America, in Asia has access to both type of services in the same health center.
Tuberculosis causes 1/4 of all HIV-related deaths. The new initiative aims to cut that rate in half to 250,000 by 2015. About $5 billion a year is needed to reach that goal. UNAIDS Deputy Executive Director Dr. Paul DeLay says it is possible.
We have the technologies. We know how to treat now. In the past, when a person had both TB and HIV, we separated the treatments. Now we aggressively treat both illnesses at the same time. We have a much better success rate. We have better drugs now, so we can now combine them. They don't interfere with each other. And so we do have the technologies. Financially, it's not an astronomical amount of money, so this is doable, and it's doable in the next 4 or 5 years.
But Dr. Espinal of the Stop TB Partnership emphasizes that tuberculosis and HIV are not just health issues. He says they have social, economic, and human rights implications that require political will to be reduced and eventually eradicated.
We need to ensure these people who make decisions, who decide on funding, who decide in political commitment, get that message clear. Otherwise, we will not be doing our job for those people affected by both diseases.
Experts here say if the global plan to stop TB is fully funded and implemented, millions of lives will be saved and millions more people will receive needed treatment. Margaret Besheer, VOA News, Vienna.